Hello CHS. Brendan has asked me to give you a brief medical update now that we are 3 months into the pandemic, into level 3 lockdown, but also into the surge and the rapid increase of cases in Cape Town. By now, most of you will know someone who has been in contact with the virus, or has had the virus, has been sick, or has had to stay away from work. And the virus that seemed way out there is getting closer and closer to home. It can cause a lot of fear and anxiety, and it can also just make us want to sort of look away and ignore it and just carry on with our lives if we don't feel that we are particularly at risk or particularly risky to others. I think at this time, as lockdown has eased, it is becoming more and more vital that we consider our own individual responsibility in stopping the spread and suffering of this virus. And so I would urge you still to consider the 5 golden rules as being as important, if not more important, than they were during lockdown. And we all know those 5 golden rules. They are to firstly wash your hands as frequently as possible. Secondly, to wear a face mask and avoid touching your face. Thirdly, to keep a physical distance whenever outside the home. Fourthly, to cover your cough or sneeze. And fifthly, to stay at home if you feel at all unwell. And those 5 golden rules are there to protect ourselves, but they're also there to protect others around us. And one thing we're learning from this pandemic is that we are not isolated islands, and that we are in community, and that we need to think of the community around us as well as ourselves. Jesus said that the first commandment and the greatest commandment was to love God with all your heart and with all your soul and with all your mind. And the second commandment is to love your neighbor as yourself. And in the parable of the Good Samaritan, he describes who that neighbor is. It's that unknown stranger on the other side of the street, someone that we have no contact with, someone that we will never maybe speak to, someone that may be from a completely different background and ethnic group, someone that we have absolutely nothing in common with. That is our neighbor. And unlike in the parable, we are being asked now to show love to that neighbor, paradoxically, by keeping our distance. And that is really important right now, to keep those 5 golden rules and to consider the most vulnerable in our society by keeping our physical distance from each other. That is how we, as followers of Jesus, are being asked to love our neighbor. And so I would ask you, with anything that you need to do, any activity you need to do outside the home, to ask yourself 3 questions. Ask yourself, is this really necessary? Is it wise? And thirdly, if it is necessary and wise, am I being safe in the way I go about it? And when we weigh up whether something is a good idea or a bad idea, it's useful to look at the risk-benefit of any situation. It's something that we do automatically in medicine. We're taught right from the beginning. Everything you do, you weigh up the risk to the patient versus the benefit to the patient. So if a patient needs to go for surgery, you'll weigh up the risk of the anesthetic and of the operation itself to the potential benefit of the patient having the operation. If you need to prescribe a medication for a patient, you'll weigh up the risk of the side effects or possible allergy to the medication compared to the potential benefit of that patient receiving the medication. And in the same way, we can weigh up whatever we choose to do as in terms of its risk versus its benefit. So think of what you want to do and think, is this something that is of low risk but of very high benefit, in which case go for it with safe measures? Or is that thing that I wish to do quite high risk and of little or no benefit, in which case we need to think again? I think it's helpful to think that of everything we do, there's a ripple effect going out. So maybe just a meeting between a few people who are healthy and low risk and not really a threat to each other. And if they do get the virus, then they won't get it badly. But there's a ripple effect going out from that little meeting that goes out like a ripple in a pond into other families and into other communities. That just goes out and out and out. And that is the way this virus is spreading, through this ripple effect from each contact. So the physical distancing and the hand washing are of extreme importance right now that lockdown is eased and people are back at work. The other thing that I just would like to talk about is the issue of testing. So we all know now that people are being tested, and you hear that so-and-so is positive and so-and-so is negative. But I firstly just want to remind you that testing positive is only a transient thing. It's not like HIV, where you test positive and remain positive forever. Coronavirus, you test positive and you remain positive for maybe 3 weeks. And then your body will develop antibodies and you will become negative. And providing that you don't get severe infection and die from it, you'll then be non-infectious and not infectious to anybody else. Only about 20% of those who have the infection will need admission to hospital, and of those, 5% may need ventilation, and of those a proportion may die. The majority, the 80%, will either have very mild symptoms or will not be symptomatic at all. So that can allay our anxiety in many ways, that most people will have mild infections, but at the same time, we don't want to take it casually and say, well, it's fine for me, I won't get it badly. Because firstly, you just don't know, and secondly, you don't know who you might pass it on to. The other thing about testing is that I may test negative today, but that doesn't mean that I might not test positive in 4 days' time. And so we're in the situation where you actually don't know of all the people around you who is positive and who is negative. Of those who have tested positive and maybe had the infection or had asymptomatic infection, yes, they have developed antibodies to the infection, but we don't know at this stage whether those antibodies are enough to be protective against another infection. So even those who have tested positive need to carry on with their 5 golden rules after they recover. They may still be at risk of another infection. And so you can see as I'm talking why the 5 golden rules are so absolutely essential for everybody to practice. A, because you don't know if you're positive, and B, because you don't know if those around you are positive. And so we all just have to practice the 5 golden rules, particularly the hand washing and the physical distancing rather, all the time. People are also getting concerned about how perhaps they will manage if someone needs to isolate at home or is mildly sick at home. And I'll put some guidelines onto the Staying Connected site that are very explicit about how to manage at home. And remember that for those where physical distancing and isolation at home are just impossible in very overcrowded situations, there are options where people can go and be quarantined somewhere else for 2 weeks, and then they can come back into their communities. And so I just want to encourage you all today. I feel like I'm always the bearer of the bleak news, but I do want to encourage you and say that we are asked to be the light bearers. Jesus asks us to show this love for our neighbors right now, and acting responsibly in showing our love in other ways, and in praying for our communities and our health workers and our leaders. And just remembering that God is our rock, He is our salvation, He is the one who will get us through this. So I just want to send you all lots of love, CHS. I look forward to the day when we will all meet again together. Goodbye for now.